Hi dudes, welcome to my channel once again. Today's class we will see one letter. This is Oet letter to a pulmonologist. So this is one type of specialized letter, but actually the letter is very small, but it is a specialized area. So we will see how we will write a letter to the doctor. That means we are referring one baby who is 10 years old already. He is on some asthmatic medications and he is suffering from asthma, bronchial asthma for the past 5 years, and in between he is getting some allergic to dust and trees, some pollen, something like that. And suddenly, or not it's like a suddenly, gradually he has some signs and symptoms. It's like aggravation, it's look like aggravation of bronchial asthma. So at the end of the scenario, the community center could not manage the cases, so they are planning to refer the patient to a pulmonologist in the hospital. So we will see how we will take the relevant data and the semi-relevant data, and how we can exclude the irrelevant data, then how we can organize the letter. So let us see the writing task. As usual, we will go to the writing task first. Using the information in the case note, write a referral letter to Mr. Mark Ruffalo, pulmonologist, Freeman Hospital, Newcastle, UK. So here we will come to know regarding the reader is pulmonologist and the full address. So only that is the thing, it's available in this writing task. Today's date is 14 May 2020. You are a nurse working in Stellar Clinic, Newcastle, UK. Mathew is your patient. So here we need the date, the letter date. It is 14/5/2020. Clinical details. Name of the patient is Mathew McConaughey. Date of birth is 29/6/2009. Age 10 years. Parents name and address has given. So here we need full name of patient, date of birth or age. So better you can take patient's name, the age 10 years. This patient has bronchial asthma for the past 5 years. We have to underline. Using an albuterol rescue inhaler approximately 3 times per week for the past 2 years. That also important. Intermittent chest infections for the last 6 months. That one also important. And this is semi-relevant data. We can write family history of asthma because it's related to asthma. So what are the things I underlined with the red, that is relevant data. The presentation starts with 5/5/2020. Complaints are wheezing, chest pain, dyspnea, and cough. Chest X-ray and CT scan normal. So which are all the things is written normal? Actually for us no need, that is irrelevant data. So we need the presenting complaints and the date when it started. Spirometry also it is no need to write. Medications we have to write so that he was prescribed with low dose corticosteroid, fluticasone, 44 mcg at 2 puffs twice per day. So that is important. 7/5/2020. Remain symptomatic, mild fever, increased use of inhaler. So here you can see more or less same things they have repeated. So for us actually these all are irrelevant data, but we have to write increase to 2 puffs 3 times per day. So it was 2 puffs twice daily, but they have changed to 3 times per day. And later on we can see 9/5/2020. Again patient started to show the same symptoms. So there the relevant data is for him they did allergy skin test and he was positive for dust trees. So the diagnosis is refractory asthma. It is nothing but patient's asthma become aggravated. Included anticholinergic and leukotriene modifier. So that one important because they have added some more medications, monitoring of breathing pattern and steam inhalation and other non-pharmacological measures to relieve cough. So for us it is important that the newly diagnosis with the refractory asthma, that is a skin allergy, this is positive for allergic to dust and trees. They have added some more medications. So these are the things we have to include here. This is today's presentation 14/5/2020. So today patient presented with the wheezing, chest pain, dyspnea, cough and thick secretions along with the fever, pale and weak. The urgent reference to pulmonologist is essential. And there are some suggestions for the pulmonologist because he may require bronchial thermoplasty. And we are sending especially for the patient for the further investigation and for the proper management. So once again, I will review the writing task using the information in the case note. Write a referral letter to Mr. Mark Ruffalo, pulmonologist, Freeman Hospital, Newcastle, UK. So this is a simple letter actually, but just I want to show the letter for pulmonologist, how we write. So just we will see the letter, how it will go.